called transtubercular line. This transpyloric line basically passes through pylorus of the stomach. You know what are the parts of the stomach? Do you know? Has the stomach been covered in your anatomy? It has been covered in physiology, right? So you basically know the parts of the stomach. Where the stomach lies, can anyone say? In between what organs the stomach is lying? First it's esophagus, then comes the stomach, then comes the duodenum, the first part of the duodenum, right? In between the junction of the duodenum and the end part of the stomach is the pylorus of the stomach. This is the terminal part of the stomach. Pylorus of the stomach. Whenever you draw a line, this is not basically a line which is already present. This is an imaginary line. So an imaginary line or an imaginary plane passing through the human body at the level of pylorus. This pylorus of the stomach and this transpyloric line or the transpyloric plane basically lies at the level of L1 vertebra. You know vertebrae, right? There are cervical vertebrae, there are thoracic vertebrae, lumbar vertebrae, then sacral ones. So at the level of L1 vertebra, this transpyloric line or the transpyloric plane exists. Okay. There are some organs around them, we will be telling you later. Then there is also called transtubercular line. Means the your hip bone has been finished, right? But the pelvic bone has been finished. So there are tubercle in both the pelvic bone, right? So in between the from one tubercle to the another tubercle, if you draw a line, this line is known as the transtubercular line. So there are two clavicular lines, one transpyloric line, the next one is transtubercular line. So these four lines basically divide this abdomen into 9 regions, right? Earlier it was 4 quadrants, then now it is 9 regions. In these 9 regions has been given some names. So you can see the first in the above row, you can see the central name is the epigastric region, right? This one is called the epigastric region. Why it is called epigastric? Because of the presence of the stomach, right? Gastric means stomach and epigastric means it's the above part. Okay, this stomach basically lies in both the, you can see this is the stomach, right? You can see, right? So it basically lies in 3 regions. So the first thing is the epigastric region. Okay, in the right side of the epigastric region it's called right hypochondrium. It's called right hypochondrium. In the left side of the epigastric region it's called the left hypochondrium. Okay, then comes the below of the epigastric region, it is called umbilicus. You know there is presence of umbilicus. So this is called umbilicus. Right to the umbilicus, this is called right lumbar. Left to the umbilicus, it is called left lumbar region. The above part of the umbilicus was called epigastric region. So the below part of the umbilicus is called hypogastric region. Then right to the hypogastric region is the right iliac fossa, left to the hypogastric region is the left iliac fossa. You know there is something called iliac crest in your pelvic bone or the hip bone, iliac crest. So see, this iliac crest basically lies in these regions. Iliac region, right iliac region, then there is left iliac region. Okay, this is the chondrium, there is the right hypochondrium means below. Since same way there is left hypochondrium. Then these areas basically are called the lumbar areas, right? These are the lumbar areas where you can find the structure of these kidneys. Both the kidneys are present in the lumbar areas. Also some part of the hypochondriums are also involved in the anatomical location of the kidney. See, you also have to know what are the organs that are present at every regions of the abdomen. Okay. See, as I have already told you, in epigastric region there is this presence of stomach. Okay. Then the liver basically lies in the right hypochondriac region. Now the left, there are 2 lobes of the liver. There is this right lobe, there is this left lobe. So the left lobe basically extends into the epigastric region also. So there is this presence of liver also. Then there comes pancreas. Okay, pancreas is present in left hypochondrium region also. And then there is adrenal glands. These are basically not seen in this region. These are mostly seen in the hypochondriac regions. Okay, so stomach, liver, pancreas, duodenum, and then there is spleen. Okay, one thing you can see is in every region you can find basically every organ, most of the organs, they are basically present in multiple regions. They are not located and fixed to a specific region. Okay, only the thing is this appendix and cecum. Okay, this appendix and cecum, where does appendix lies? Do you know anyone? Appendix lies in, what is it called? This junction, there is some junction is there. Ileocecal junction. So there is this appendix and then there is cecum. Okay, these things lies in the right iliac fossa and they do not share any other regions. They only lies in the right iliac fossa. One thing is you can see in the right hypochondriac region, I have already told you there is presence of liver. So along with liver there will be presence of gallbladder. One thing is they have written right kidney in the right hypochondriac region, but nowhere in the right lumbar region right kidney is mentioned. But one thing you should know, the kidneys of both the sides basically lies at level of T12 to L3 vertebra, thoracic 12 to lumbar third vertebra. So if thoracic 12 to lumbar third vertebra is the anatomical landmark of kidney, and a line that is called the transpyloric line that stays at the level of L1 vertebra, then definitely this kidney is lying in two regions, T12 to L3 and L1 lies in between them. So the kidney is basically shared in two regions. Okay, there is something wrong with this image, I guess. So this kidney lies in T12 to L3 anatomical landmarks, and L1 lies, L1 basically cuts the kidney to two regions. The right hypochondrium and the right lumbar, the left hypochondrium and the left lumbar. One more thing is there, this right kidney is a bit situated a bit lower in compared to the left kidney because of the liver. Okay. The other things are there is this presence of right colon. You know, after the stomach there is this small intestine, duodenum, jejunum, ileum, then ileocecal junction, cecum, then there is this colon. The first part is this ascending colon, right? There is this ascending colon or the right colon, they'd say. Then there is transverse colon. Transverse colon basically lies throughout this region. Then there is this descending colon. So this is the ascending colon, this is the descending colon, right? And what lies in this hypogastric region is this urinary bladder, sigmoid colon, and in case of females, the female reproductive organs. Okay. And in the right iliac region, there lies is appendix and the cecum, while in case of left iliac region, there is descending colon and the sigmoid colon. Okay. So these are the mostly the anatomical landmarks in compared to different 9 regions of the abdomen. What are the importance of these things? The importance are, whenever a patient will come, a patient will complain, you are basically going to write it in quadrants first. In chief complaint or in the history of present illness, you are basically going to write in quadrants. But whenever you will be examining a patient, like for example, a patient comes with complaint of left upper quadrant. Okay. So one thing you are sure ki it is mostly related to these regions. Okay. So it's very vague when someone tells ki sir there is paining in the left upper region of the abdomen. When you examine and you with history, if you suspect this patient is like suffering from gastritis, okay, now whenever you will be examining in systemic examination or examination of abdomen especially, what you will do is you will try to palpate this epigastric area, okay, with more concern. because you know the system involved after taking history or the general physical examination is this abdomen or the gastrointestinal system is the involved system after a patient is given you history and general physical examination. Now when you will be palpating, your most concerned area will be this epigastric region, because this is mostly related to the stomach part. Also there will be findings or there will be pain or the tenderness in the left hypochondriac region also. Even the pain may shift to the umbilical region also. But depending on regions, you can examine the patient and write your findings as per the findings of your systemic examination. Okay. For example, a patient is come with appendicitis. You definitely know the only region that can be involved is the right iliac fossa. These are basically called fossas, okay, right iliac fossa and left iliac fossa. You definitely know this appendix is only shared in the right iliac fossa. You know where to palpate. Once you diagnose this patient may have appendicitis, you know definitely where to palpate. And whenever you will find after pressing there is tenderness on the right iliac fossa, you are completely sure this patient is suffering from appendicitis. So that's where lies the functions or the mostly the importance of knowing the 9 regions of abdomen. Okay. All of you have noted it down, right? This is an image in Google. Many images are there. Try to learn all the organs that are situated in different regions of the abdomen. Okay. The 4 quadrants of the abdomen, the 9 regions of the abdomen. Now we will be making 4 groups of 12 to 13 students each, and we will be demonstrating you taking one of from each group as a volunteer. We will be demonstrating you starting from the history to general physical examination to examination of abdomen. Okay, so we will ask you to go to the clinical physiology room. Okay.
Okay. So what will you see? How will you see pellet? No, you say something to her, no? No, head should be straight and she should be looking up. Now you will see the lower palpation. What will you look for? For the paleness. If it's right or pain. If it's pain, it's suggestive of anemia. Okay. Then what is ignorance? मुझे दिखाओ सर फेस हियर now yeah like this okay you will see the English description of sclera. Can you tell me why we see only the sclera for diagnosing jaundice or pancreas? Because the bilirubin has more affinity towards the collagen of sclera. Okay, that's why it has more tendency to deposit in the scleral region. At more than 2 milligrams per deciliter, it is deposited here. Suppose there is more attraction of more affinity for this bilirubin molecules. That's why it gets deposited here. Okay, now what more do you know? If you eat something and there is edema, edema means collection of fluid in the intestine. Okay. Before going to that part, we are going to ask the general test. At first, what do you see in the patient? The patient is conscious, he is oriented, the patient is having fever, the patient is having like disorientation is there or not? How will you see if he is conscious or unconscious? Orientation. If he is oriented to time, place and person, you will ask his mind like again, you will remember him. First is oriented to person. Oriented to time means You remember the time? I called the day. He's saying it is Valentine's Day. No. Okay. Time, please. Where do you? Place. Person and time. And now, next, fever. Fever agony. You can ask him or does it by asking for permission. Always remember about fever numbers because this you cannot feel properly. It's better to feel like this. Okay. Temperature figure next. Okay. Next round. PT, pulse, respiratory rate. So PT, what is number PT? Which number? 120. Yes, it's 120 by 8. 120 by 6. It is considered as normal. Okay. It can have a range. It always have a range. Okay. Suppose the patient is having like 180 systolic BP. Doesn't mean it's abdominal BP. Down to 90. 80 to 90. 90 के ऊपर जाएगा तो हम उसको बोलेंगे diastolic hypertension. Diastolic hypertension. अभी देखो इस बार pulse. Pulse कहाँ पे radial pulse then
neck पे भी देख सकते हैं.
neck. Arterial pulse then brachial pulse then femoral pulse. Femoral pulse. But here we also this is called dorsal ventral artery. You can also find the pulse. Sir, here the regions you can find the pulse. This is the major region where you can try to see the pulse. If you can't find the pulse here, you have to the remaining. Okay. Then or femoral pulse. More easily find. Next. Lymph nodes. You know what is lymph nodes? There are different structure comprised mostly of lymphocytes. There are different lymph nodes in our body. This has some clinical importance. Like in case of severe, many diseases like tuberculosis, cancer, because of the leukemia, any type of infection maybe, there is swollen lymph nodes. So you are going to find the position of the lymph nodes and it will be swollen or not. People say that my tonsil fulgurans. This is also a type of lymph nodes. No, it is not lymph nodes. Tonsil is kind of similar like lymph nodes. Also the same immune cell. So what are the positions or how do you examine lymph nodes? Not like this. You come here. You will ask the patient to sit down. Okay. You not go to sit down. Suppose there is a chair which is sitting down here. Now next, what will you do? Before understanding, before knowing how to this feel the lymph nodes, you are going to know at first where the position of the lymph nodes. What are you saying? This is called submental lymph nodes. Here, you have the submental. This is called mental region of this mandible. Submental region of here. It is submandibular lymph nodes. This is 1A. These are called different sections of lymph nodes here. Suppose this is called 1A, this is called 1B, and here along this the cervical lymph nodes along this muscle. What is this muscle called? Sternocleidomastoid muscle. Along the sternocleidomastoid muscle, there are three groups of lymph nodes: upper cervical, middle cervical, and lower cervical lymph nodes. Level 2, level 3, level 4. Okay. Now there comes the posterior lymph nodes. The picture I got posterior lymph nodes. Level 5. Then I got here posterior, and then supraclavicular, and then supraclavicular case. these are the clavicles ना, clavicles के ऊपर तुम ऐसे feel करो, ठीक है? How will you feel this? This is level 2, level 3, level 4. 1A, 1B. What this? How will you feel with the palm fingers? ठीक है? And at the end there are level 7 होता है. 7 is retrosternal, पीछे आएगा. और sternal पीछे. That you can't do. For that look over. This is cannot happen. Okay? Alright? The lymph nodes. How to examine the lymph nodes? ऐसे करोगे? Panther पीछे जाओगे. पढ़ोगे then sit down. Okay? Sit down. You will take. मैं क्या बोला? This is 1A submental. This one क्या है? Submandibular with upper cervical, middle cervical, lower cervical. This one क्या? Posterior lymph node. Supraclavicular lymph node. या supraclavicular.
Posterior lymph
Posterior
nodes.
पीछे होता है. ना posterior triangle. जब तुम neck पढ़ोगे ना, you will see there is a different triangles, anterior triangle, posterior triangle, capital triangle. उसमें posterior triangle होता है, posterior lymph node. And the seventh lymph node is in the right position समझ में आ गया? She will be sitting here. You will be asking her, okay, I will be examining your lymph nodes. Okay, are you getting the concepts? Yes. You will go here. Here. ऐसा करोगे? Process. पहले submental. Then submandibular. Then upper cervical, middle cervical, lower cervical. पहले वो muscle को feel करो. See this muscle upper, middle. ठीक है? Good.
सर वो फील होगा कैसे?
If only they are not fed normally, if only this is enlarged, then only you can feel. किसी का हुआ है कभी infection में tonsillitis हो गया था, then only you can feel this ना है? हो गया ना? So whenever there is tonsillitis, there is so many fluid and if you want to examine or calculate the tonsil, किसी का हो गया, ऐसे feel करो, that हाँ, there is हाँ, okay, this is submandibular. Got it? Okay, lymph nodes.